Does treating sleep apnea with ASV improve heart failure prognosis? Have you ever wondered if treating sleep apnea can actually help with heart failure? Today, we are going to look closely at adaptive servo-ventilation therapy and its effects on heart failure prognosis. Adaptive servo-ventilation, or ASV, is a therapy aimed at treating sleep apnea, especially central sleep apnea. It provides ventilatory support during times when breathing stops or slows down. This therapy is often considered for patients who have heart failure and also experience sleep-disordered breathing. In patients with heart failure and reduced left ventricular ejection fraction, which is a measure of how well the heart pumps blood, ASV has shown some benefits. It can improve sleep quality and reduce the severity of apnea episodes. However, while these improvements in sleep-related measures are promising, they do not translate into better heart failure prognosis. In fact, some clinical trials have raised concerns about ASV potentially increasing the risk of cardiovascular death in certain patients. For instance, the SERVE-HF study found that patients with heart failure and reduced left ventricular ejection fraction who were treated with ASV had a higher rate of cardiovascular mortality compared to those receiving standard medical therapy. Because of this increased risk, ASV is not recommended for patients with symptomatic heart failure and reduced ejection fraction who also have moderate to severe central sleep apnea. This means that for these specific patients, ASV should not be prescribed, as it could do more harm than good. However, ASV may still provide benefits for other heart failure patients who do not have reduced ejection fraction or who have obstructive sleep apnea. Evidence for improving long-term heart failure outcomes in these groups is still limited, but the therapy can help improve sleep apnea severity and overall sleep quality. In summary, while adaptive servo-ventilation therapy can effectively treat the breathing issues associated with sleep apnea and improve sleep quality in some heart failure patients, it does not improve heart failure prognosis in those with reduced ejection fraction and central sleep apnea. Therefore, it is essential for healthcare providers to consider each patient's unique heart failure characteristics and type of sleep apnea when making treatment decisions.